You mentioned right in the lead-in that 22 million number, 22 million fewer people insured after a decade than under current law. That's almost as bad as the House version that said 23 million, which the president called mean. So Republicans are going to be faced with questions all day long if that 22 million is acceptable. Stephanie?
All right, we're going to bring my panel in to break it down. Sahil Kapoor is a national politics reporter for my former employer, Bloomberg Politics, and my panel, two MSNBC contributors and favorites of mine, politics editor at TheRoot.com, Jason Johnson, and former advisor to Senator Rand Paul's campaign, Elise Jordan. Sahil, let's start with you. These numbers, when you break them down, they're stark. 22 million people will lose their insurance over the next 10 years under the Senate plan. How do moderates swallow that bill?
These are tough politics, Stephanie. It's certainly 22 million people over 10 years. Just in 2018 alone, it'll be 15 million people, according to the CBO. There'll be about a $770 billion Medicaid cut that is making a number of Republicans nervous, particularly in Medicaid expansion states. Some people in states like West Virginia, Shelley Moore Capito and Rob Portman in Ohio, have opioid epidemics, and these Medicaid cuts would hit some of the most vulnerable among them. Mitch McConnell has a very tough fight to get to 50 votes in the Senate. There is a path, however, and I would keep a very close eye on this for the conservatives, people like Mike Lee, Ted Cruz, Ron Johnson. Some more deregulation, some more flexibility, some more opt-outs for states could get the job done with them. And for the moderates, some of these members in states suffering from the opioid epidemic, Mitch McConnell has about $200 billion that he can spare, given the reconciliation rules and based on what the CBO says, this bill saves more compared to the House bill. He can use that money to try to win some of the moderates, either by easing some of the subsidy cuts, easing some of the Medicaid cuts, or providing treatment funds for these states. So it's going to be a tough battle, but he's a very, very effective and strategic legislator, so I wouldn't count him out on this.
All right, Mitch McConnell is very good at this, but let's talk about what's motivating him. While you're taking away health care, and I get it, there's access to it, but you're taking away health care from millions of people. Can we just walk through the tax cut for the wealthy? I want to go through the numbers. The top 0.1% who make $5 million or more are going to get $250,000 a year in a tax cut. The top 1% who make $875,000 a year get more than a $45,000 tax cut. Take your political leanings aside, Jason. What is your reaction? Where is the math, the strategy behind this? It can't simply be trickle-down economics. These people have more money. They're going to be spending more money.
Yeah, I don't think healthcare trickles down. So it doesn't really matter if those people get that much of a benefit. It's just purely ideological. You have a lot of Republicans who just don't fundamentally believe that healthcare is a right, and therefore they don't really think the government should be involved. They also want to cut taxes. You know, ideologically, I think that's fine. I think that's consistent. But on a practical level, on a practical, functional, economic level, it harms the country. On a political level, you got 15 million people who are going to be off their health care by next year. There will be consequences at the polls. I don't understand how they can put ideology over practicality on something like this.
I would argue it is a political move. I would argue that this is all about the GOP donor base and the big donors who really want a big tax cut and are lobbying hard with these senators for them to approve this health care bill.
But how does that get you reelected? President Trump has this bulletproof base. I saw Angus King on Morning Joe earlier who said President Trump's base is so strong, they take an attack on Trump like an attack on them. Yeah. But if those people lose their actual health care, if it is a live and or die situation for them, how on earth can President Trump spin it as blame it on Obama, blame it on someone else? This here is Trump care.
Well, this is not a populist health care plan. This is not what President Trump campaigned on.
But that's who elected him. Rich GOP donors did not elect him.
And now he looks to be in the pocket of rich GOP donors. And so who does Donald Trump really advocate for? His base, or is he just going to be a conventional big government Republican who's out still in the pockets of all the donors?
Okay, hold on then. On that note, I want to share, Garrett Haake actually caught up with Lindsey Graham, and I want to share what he said.
If the House bill was, mean, according to the president, at 23 million, what's the Senate bill?
Here's what I would tell any senator. If you count on the president to have your back, you need to watch him.
If you're counting on the president to have your back, you need to watch it. And he's giggling. Those rich GOP donors didn't vote for President Trump. And while they're behind him now, when you speak to them behind closed doors, they roll their eyes. They're happy that he won, but they don't like him.
Right. They don't like him. They don't necessarily trust him. He's not consistent. He doesn't have the back of his legislature. I don't necessarily think he's going to be out there stumping as much as he needs to save people. And look, you're absolutely right. Trump has this amazing base. He could shoot somebody in the middle of the street and everybody loves him. Doesn't really matter. But people who are losing their health care, they're going to take it out on somebody next year. And all these videos, and I just keep thinking about this from a campaign standpoint, the video of all the members of Congress popping bottles after they pass it in the House, pictures of disabled people being dragged out of the White House in the Senate building, you know, with inhalers and things like that. That is going to crush many Republicans in marginal districts next year and possibly take down some governors. Doesn't make any sense.
Sahil, I want to share a piece of research. Harvard Research did a study. It was published by the Center for American Progress. And yes, I know Center for American Progress has an agenda, but Harvard doesn't. If 23 million people lose their health care coverage, 217,000 additional deaths, those are deaths, will take place over the next decade. That being a number that they have to swallow, how does Mitch McConnell, who's extraordinarily skilled at this, get this thing over the line?
Well, that's the political pendulum swinging back in the other direction, Stephanie. Republicans were so effective at opposing Obamacare and forcing Democrats to own everything bad in the healthcare system as a result of it passing. I think it was Senator Manchin of West Virginia, the Democrat, who made the point that a lot of his constituents, a lot of Americans don't know what it was or who it was that helped them gain the coverage that they've gotten over the last few years. But he said they surely will know who took it away from them. Now, of course, these consequences will come in the later years. The Medicaid expansion begins to phase down in 2020. The subsidy cuts begin in 2019. It's all going to happen, but it's all pushed off for a few years, so the consequences won't be felt immediately. Who knows who's going to be in power then? But look, this is a 7-year campaign promise that Republicans have been pushing pretty consistently, pretty fervently. It was the price of admission for every Republican who wanted to win the presidential primary. President Trump adopted it seemingly reluctantly. He was still saying things like, I want to insure everybody and cover everybody, sounding more like a progressive than a conservative at the time, but he's adopted this and he's all in. And his first legislative priority for him, it's a question of whether he can get big things done, and that's the same question that Mitch McConnell and Speaker Ryan face.
We should probably just qualify. It was a campaign promise for 7 years to repeal it and replace it with something better for millions of Americans.